Romosozumab in postmenopausal women with low bone mineral density. Definition: Sclerostin is an exocyte-derived inhibitor of osteoblast activity with a monoclonal antibody. Romosozumab binds to sclerostin and increases bone formation.
Risk factors for osteoporosis include being female, being older, postmenopausal, a Caucasian or Asian background, having a low dietary calcium and vitamin D intake. Treatment options for osteoporosis include calcium and vitamin D, and those are, of course, the mainstay of all treatment. But additional choices that we have available include bisphosphonates, teriparatide, and denosumab. There's a new drug in the pipeline. It's a monoclonal antibody known as Romosozumab, which is a very exciting treatment option. It's an anti-sclerostin antibody that increases bone formation. The Romosozumab study was published earlier in 2014 in the New England Journal of Medicine. This was a dose-finding study. After a one-year period of time, the Romosozumab increased bone density to a greater extent than the best treatments that we currently have, including teriparatide and alendronate. Well, I think it's important for physicians to think about the diagnosis of osteoporosis, especially in elderly patients and also in those who've had a fracture. It's important to think about the diagnosis and order a bone density to measure bone mass and then initiate treatment. It's important for physicians to be aware of current treatments for osteoporosis, but also to realize that new treatments are on the horizon, which likely will be even better than the ones we currently have.
Application in medicine. This study evaluated the efficacy and safety of Romosozumab in postmenopausal women who had low bone mineral density.
Here's your story.
I'm here at St. Jude Medical Center. I'm here for my osteoporosis scan.
Subjects are for the area that we're looking is the L4, L1 area, the low back, lumbar spine, the neck of the femur, as well as the head of the femur. These are the areas at greatest risk for fracture.
Okay, Deborah, maybe just go ahead and have a seat on the table here.
I hope my results will be perfect because I exercise and I try and eat foods that have a lot of calcium and try and have a high protein diet.
Okay, Deborah, so the last part of this is going to look at both hips. It was quick and easy.
Yeah, thank you very much.
My pleasure.
So when will I be hearing my results?
Deborah is here with us today, along with Sally, and first things first, you're anxious, right?
Yes, very anxious.
So shall we just cut to
Absolutely.
Okay. So look up there. You see that little dot where it says normal in the green range? That's where you're at.
Yay!
Remember, we're
Yay! That's what I wanted. High five.
Thanks. And that test, Lisa, you can hold those bones up quite simply is measuring your bone mineral density. In Lisa's right hand, that's good bone mineral density. In her left hand, it's very porous, and that is the bone of someone with osteoporosis. Yours looks like the denser one. That is good. Now, having said that, we're going to talk about ways to prevent yourself from ever sliding into the zone of osteopenia or osteoporosis. Because it doesn't mean that you can never move in that direction. So strong bones for life is the key, right?
Right, but again, the onus again is to identify people who have the risk factors or signs. If you see, back pain, stoop posture, something like that, You want to identify, again, people who are at high risk, their family history, their age, if they've been taking medications like steroids or cancer treatments, if they have hyperthyroidism, other medical disorders that can make your bones. And it's not necessarily a disease of menopausal women or older women, or actually even Caucasian women, Black women, everybody can be affected by
Everybody
this.
should get a bone density test
Absolutely.
at some time in their life,
Well, then-
probably as
right.
they turn into their early
Well,
60s.
gynecologists recommend,
Yeah.
I recommend to all my patients that you get it at 50, or at least when you start menopause, 1 year after menopause. So that's when you should actually have the screening. Okay, but the fabulous thing is that you don't have to worry about treatments. You have been taking a treatment, right?
Yes,
And you've been taking
thank God.
your bones, even though they started to get like this, are now reversed because of the treatment that you're taking.
The treatment that I've chose, there's many different treatments to choose from, and the one that I take, which is once a month, has made my bones in that healthy zone again.
What medication did you take?
I'm on Boniva because it's once a month, but like I say, there are many effective treatments. They also have one that can be given intravenously that lasts for 3 months, I think, for women who can't tolerate anything digestively.
That's excellent, Sally. I mean, I know everybody wants to take what Sally's taking, and there's so many different treatments out there as well, though. Hormone replacement actually helps build bones as well, even though it's not in.
The pros. All dose levels of Romosozumab were associated with significant increase in bone mineral density at the lumbar spine, and the cons. Patients with present non-recurring injection site reaction with Romosozumab. Adverse events were similar among groups.
One of the big problems we're discovering is not that the drugs are a problem. It's that people are a problem. People stop their medicine. If you get prescribed one of these drugs and you stop it after 6 or 7 months, you're not going to get any long-term benefit. It's only going to work if you take it. Your grandmother could have told you that. And we've got lots of data that show us that when people take their medicine less than half the time, it doesn't do anything. If you take a bisphosphonate 50% of the time or less, at the end of a couple of years, there's no fracture benefit. You don't reduce fracture risk. If you take it 75% of the time, you start to see a real benefit. If you take it 100% of the time, it's even better. Logical. So if you're going to take it, you got to take it.
Issue playing in postmenopausal women with low bone mass, Romosozumab was associated with increased bone mineral density and bone formation with decreased bone resorption. In Necor, it is used the Romosozumab, but it's kinda expensive. So the rheumatologists and other people recurring another kind of medicine like anti-TNF.